Text, Harvard University. Bruce Walker, Harvard Medical School, MIT and Reagan Institute.
We saw a patient with a disease that nobody had ever seen before. Patient rapidly died.
2 doctors stand around a man laying in a hospital bed.
And then we saw another. And then we saw another.
A doctor places a stethoscope to the chest of a man with lesions.
And that was really the beginning of the HIV epidemic.
On March 24, 1998, protesters carry an upside-down American flag with the text 30,000 dead of AIDS written on the stripes.
I realized then that we as physicians on the front lines were going to be the people to see new diseases, and if we didn't do research, we were going to watch a lot of people die. And that, to me, is really what research is about, and that's why it's so critical. There are 36 million people that are already infected.
The number 36 million rolls down to 18 million.
Only half of those have access to therapy. Without lifelong therapy, the virus will win the battle. My research in HIV/AIDS is trying to solve 2 problems.
A woman addresses an audience of people.
One is trying to prevent people from becoming infected, and the other is trying to do something for the people that are already infected by developing a vaccine that could teach their immune systems to do a better job of fighting HIV infection. And the way that we're approaching that is to try and learn from people that spontaneously control without medication, learn what it is that they're doing so that we can try and replicate that in other people. We were able to bring resources that were available to us here to South Africa, to the heart of the epidemic, create 2 institutes there to tackle the biggest health problems they've got, to bring multiple other Harvard scientists into the mission, and to work with our collaborators to train a next generation of African scientists.
A group of medical professionals stand along a wall.
And I feel really proud of that. What has become extremely clear to me from our work in Africa and also from our work in Boston is that none of these diseases is just a scientific problem. None of them is just a social problem. None of them is just an economic problem. It's all of these things wrapped together, and I think that's where an institution like Harvard has the ability to make a tremendous impact.
Dr. Walker looks at a slide in a lab with 2 other people.
There is so much talent in this couple-mile radius of hospitals and research institutions and universities. It's really unparalleled. There is no better place to create knowledge than here, and I have to say, I love being here.
Text, Harvard University. The Harvard University Shield. When the World Was Ours, piano ambient background by Xandersfree. https://